Hi, this is Jeffrey Strickland again, MMOT 136, and I'm going to do procedure 30-10, which is suturing a laceration or repairing an incision. And I've already performed some of those tasks. I'm just assuming that I have a wound that was bleeding, was deep enough to require sutures, and the provider has ordered that. So when I go in, have my equipment laid out, introduce myself to the patient. I've already done the asepsis scrub and I've donned the appropriate sterile gloves, procedure 30-1. So now I have my gloves on and I'm going to confirm and explain the procedure that's going to be performed with the patient, making sure that I've identified the patient correctly with two forms of identification. For example, name and date of birth. I'm going to review the patient health history. I'll make sure there's nothing that we're doing that would harm the patient, like using type of suture that they may be allergic to. In this case, I'm assuming that they're not allergic to silk. I'm using silk braided size 4 for stitching. Make sure that we've reviewed and signed the consent form for the procedure. And then we're going to look at the wound. I have a lot of wounds on my practice skin here, and I'm just going to select one arbitrarily, so I'll take this one here. The first, I'm going to do actually 2 stitches. The first one I'm going to do is a simple interrupted one suture. And you would use that if you wanted to close something quickly, and the incision or puncture, if it were such, would be a small surface area. I have scissors, Addison pickup, and my needle holder. Again, this is a number 4 silk, and then lay this out. Now this is longer than normal stitching, but it gives you plenty of stitching to play with, practice with. So I want to put this, set the needle into the needle holder. What I'm going to do is grab it right at the end, so that's at about a 90-degree angle. I like to kind of angle mine out a little bit because of the way I hold the needle holder. And actually, I don't want to do it that way because I want to do the right hand stitch. So now I have that at an angle. There's a proper way to hold this with thumb and index finger. I don't do it that way. I do what's called a palming technique. Gives me more control over the stitch. Okay. So with my forceps, what I do is I don't hold the needle or the thread with the forceps. What I do is I secure the skin when I'm making a stitch, and you can see that the control I have with the palm is my finger's closer to the end of the holder, the needle holder, and I can control the stitch better, or the bite. So I'm going to put the first bite in and grab the skin there. Go in appropriate depth until that comes out. Again, I'm just holding the skin with the forceps. And I'll grab the needle and pull it the rest of the way through. And I'm going to pull it all the way up to the end of the thread so that I can have it ready to tie off without having to cut my valuable silk stitching here. And then I'm going to go with the kind of the same process for the second bite. And you really want to handle the needle as less as possible so you don't accidentally suture yourself. You use the forceps to grab the skin. Take the needle, put it in the appropriate depth. Make sure it's right across from the other stitch. pull it through. And then I'm going to tie this stitch off. And the way I'm going to do this is with, really what it is a couple half hitches and a square knot. But the way I'm going to do this is I'm going to take the thread, and then wrap this around the needle holder, a couple loops. It's the wrong way, there we go. And I'm doing 2 loops because what I'm going to do is, this is really a double half hitch. And when I tighten this, it'll kind of snap and give kind of a locking mechanism. So I pull that loop through. Don't get it too tight. You don't want to stress the skin too much. You just want the wound closed. And then when I do this little snap here, that secures that first loop. So in the second one, I'm going to do a square knot. So I just want to do this once. That way. There we go. And then the last one I did the outside of the needle holder. I'm going to do the inside this time for the loop, because what it does, it kind of gives like a figure 8 loop, which makes a square knot. And then that's a good tight stitch there. I'm going to trim it. Okay, so that gives you one simple interrupted stitch, and it's tied off with a square knot, and that would be for if you want to do something a real fast stitch. That's a good common one to do. So I added a second stitch but did not film it due to just the time constraints on the video. And the second stitch was called a figure 8 stitch. It actually looks like an X, and it was tied off in a similar manner. After we do the stitching, there's some additional tasks that we need to perform. One of those is to apply new gloves, and following the provider's guidance, we would cover the wound, protect it. We also obtain vital signs from the patient and record those, as well as assess their stability to see if they're ready to be released. And then record that information in the medical record. We'll also take some time to educate the patient and provide them with written instructions to follow. And then we'll arrange for post-operative prescriptions that would come from the provider, and also follow-up appointments. And then as needed, after the patient has left, we would don additional PPE to clean up and sanitize the instruments for future use.